Good morning for those in the United States, and good afternoon and good evening for those joining from around the world. Thank you so much for joining us for this webinar to look at the impact of population health and environment projects, a synthesis of the evidence. I'm Karen Hardee, the director of the Evidence Project, which is hosting this webinar, and I'm really delighted to have Kristen Patterson and Clive Mutunga join us as speakers today. Before I introduce our speakers and get started, I would like to just tell you a little bit about the Evidence Project and the genesis of this synthesis. The Evidence Project is a 5-year USAID funded project of implementation science to improve the outcome, family planning and reproductive health outcomes. The project sort of has 3 goal areas, and that is to generate new evidence on issues to address improving family planning, reproductive health, to synthesize bodies of evidence, of existing evidence that could be implemented in countries to improve reproductive health, and then getting that evidence used. We work globally and in a number of countries, and we have a number of partners on the Evidence Project, including PRB, who Kristen Patterson works with PRB, and was absolutely perfect to undertake this synthesis. The first speaker is Kristen Patterson. Kristen has over 15 years of experience working at the nexus of community development, public health, and environment conservation. Prior to joining PRB, Kristen managed external affairs for the Nature Conservancy's Africa program for almost 6 years. During her tenure at TNC, she helped launch a PHE project in western Tanzania called Tungane in partnership with local communities, Pathfinder International, and the Frankfurt Zoological Society. Prior to TNC, Kristen worked in Madagascar as a USAID-funded Population Environment Fellow. Kristen has an MPH from Johns Hopkins, and her focus was on women's and reproductive health, as well as a master's in conservation biology and sustainable development, and a certificate in African studies from the University of Wisconsin-Madison. She began her career as a Peace Corps volunteer in Niger, and she speaks French and Hausa. So Kristen will be presenting this synthesis, and then Clive Mutunga will offer reflections on it and sort of start us off with a discussion, and then we'll follow with questions. And Clive is a Population Environment and Development Technical Advisor at USAID's Office of Population and Reproductive Health, where he serves as the technical leader in the elevation and advancement of the linkages between population and environment. Clive has several years' experience conducting and communicating research and analysis, program design, and evaluation on a broad range of development issues, including environment, population, and health. Prior to USAID, he was Senior Research Associate at Population Action International, known as PAI, where he worked mostly on population and development issues and climate change issues and development. And I was very fortunate to work with Clive when we were both at PAI. Prior to PAI, he worked on environment and development policy in East Africa. Clive is a trained economist with specialization in environment and natural resource economics. So I think you can see we have 2 excellent speakers today for this webinar. So Kristen, I'd like to turn it over to you to present the findings of the synthesis.
Okay, so as Karen was saying, I'll be sharing highlights of a recent synthesis report that colleagues and I from PRB published that focuses on synthesizing the evidence from available documents of the impact of PHE projects from about 2005 to the present. For those of you who may not be familiar with population health and the environment, here's a brief definition. The PHE approach acknowledges and addresses the complex connection between humans, their health, and the environment. PHE programs use integrated approaches to improve access to health services, especially family planning and sexual and reproductive health, while helping communities manage natural resources and conserve the critical ecosystems on which they depend. So I know you are all wondering, why on earth would anyone want to read over 60 PHE project documents? Well, integrating family planning into development, health, and conservation projects is promoted as a win-win for all sectors involved. However, advocates, policymakers, and donors keen to support and expand this approach have really wanted to see more evidence of the impact that these types of multi-sectoral integrated projects can have. And the last summary evaluations of PHE projects were completed back in 2000 and 2008, so it's been a while since evaluations have been done. And since then, results have emerged from a second generation of PHE projects. These projects have learned from past monitoring and evaluation successes and challenges and present new opportunities for documenting the impact and benefits of PHE. But for this synthesis, in contrast with earlier reports, we didn't evaluate the second generation of PHE projects. Instead, our focus was on documenting, first, what is being measured by integrated projects and what they are not measuring. Second, the proven benefits of integration. Third, the gaps in the PHE evidence base. Fourth, the successes and challenges for documenting the impact of PHE projects. And finally, the case for why PHE is an effective development approach. The assessment included projects that have been already completed as well as some that are ongoing. So we read over 60 PHE project documents. Of those, 43 documents from 35 projects were selected to be included in the synthesis, since they met our criteria of integrating aspects of population, health, and environment in some way. And as you can see on the map, the majority of the projects are located in sub-Saharan Africa, especially in Eastern and Southern Africa. While some projects began as early as 1992 or as late as 2012, the vast majority that we looked at began implementation in the mid-2000s. A full list of projects is available in the report, and we'll be sharing a link to the report at the end of our presentation today. So the documentation from the various project activities included interventions in all of these sectors shown here. And the population interventions included activities like family planning and reproductive health service delivery and behavior change communication, health interventions such as HIV/AIDS awareness, prevention and treatment, maternal and child health services, and water sanitation and hygiene, known as WASH, environmental activities such as wildlife conservation and natural resource management, and also livelihoods and food security. Our goal was to look for the documentation of impact in line with the already established benefits of PHE, such as those cited by Pielmeyer, Hunter, and Lang in their 2007 report. And those impacts include increased access to and use of contraceptives and improved health outcomes, especially in very remote, underserved areas where PHE projects usually take place. Improvements in environment indicators beyond what can be achieved in single sector projects. Greater buy-in and more rapid mobilization of communities, leading to quicker short-term results. Greater involvement in natural resource management activities due to the incorporation of health, livelihoods, and microcredit components. Increased access to and involvement of males in family planning and reproductive health, and of females in conservation and natural resource management activities. And finally, time and cost savings, both for implementers and for the communities themselves. So of the 35 projects that were included in the synthesis, almost 70% reported some family planning results, almost 60% reported some environment results, and fewer, about 40%, reported results that were integrated population health and environment indicators. In the next couple of slides, I'll share more information about what we found regarding the evidence of impact for each of these sectors. For population and family planning, we found that projects focus on access to, use of, and support for voluntary family planning within communities, using a rights-based approach. Data on family planning are among the more consistently reported indicators for PHE programs. Most of the programs used contraceptive uptake as their key family planning indicator. They measured it in different ways though. Some projects measured contraceptive prevalence rate, or CPR, others couple years of protection, and others looked at unmet need. 23 of the 35 projects reviewed, or about 65%, reported data indicating some type of increase in family planning use. The most dramatic family planning impacts were seen in remote areas that had little prior access to family planning. For example, in Madagascar, Blue Ventures recorded a change in CPR from 10% before the project began in 2007 to 55% by 2013, after the organization integrated reproductive health initiatives into their conservation activities. However, despite its source as the P in PHE and the fact that many PHE projects seek to reduce long-term pressures on the resource base by slowing population growth, few projects in the report actually measured changes in population size or growth rates. Furthermore, we found that few PHE projects operate long enough or collect sufficient data to conclude whether the family planning and reproductive health programming they were doing contributes to declining fertility and long-term slowing in population growth rates. The limited evidence base for impacts on population indicators such as parity, total fertility, and population growth suggests a gap between project communication and impact. Early review of PHE projects suggests that incorporating additional health components beyond family planning were a key way to build community support for PHE projects, including maternal and child health, HIV/AIDS awareness, prevention and treatment, and environmental health activities. And often these were the highest demand activities in the communities. In the report, we found that because of the close relationships between water, sanitation and hygiene, the environment, and health, PHE projects frequently measure and document WASH impacts. For example, the Tungani project in western Tanzania reported that over 1,100 new latrines were constructed by community members with their own resources as a result of sensitization activities led by community leaders who are also fishermen and involved in the natural resource management activities of the project. These fishermen have become key players in project-led sanitation efforts, which contributed to no cholera cases for the past 2 years in the 6 project pilot sites. On the environment side, many PHE projects report changes in environmental behaviors among households, as well as in management practices by communities and user groups, such as reductions in slash-and-burn agriculture, improved fishing practices, and designation of new protected areas. For example, the Health of People and Environment in the Lake Victoria Basin Project, or HOPE LVB, reduced destructive fishing behavior and promoted the protection of community natural resources through the establishment of 16 fish breeding sites. We found that PHE programs, by large, successfully adapt their environment approaches to the local context. Few PHE projects, however, are collecting different types of ecological data to document the actual impact of behavioral and management changes on the overall environment at a higher level. There are probably multiple reasons for this scarcity of environmental data. First of all, PHE projects focus at the household level and community-level natural resource management interventions versus large-scale landscape impacts. A second challenge is that collecting environmental data requires really specific expertise that is often outside the knowledge and experience of most field-level PHE project staff. Third, many of the environmental impacts of behavioral and management changes, such as regeneration of fish stocks or improved forest cover, are only visible over long periods of time, and projects that are only 3 to 5 years can't track those changes. Thus, the projects have a hard time showing change during the short project timescales. However, this does not mean that the projects will not have long-term impacts. It just suggests that some ecological impacts won't be clearly measurable until after the project ends. Despite these challenges, there are several projects that are now collecting ecological data to demonstrate the environmental impact of PHE efforts, such as the Tungani project in western Tanzania and Blue Ventures in southwestern Madagascar, and more projects like these are needed. Despite not being included explicitly in the PHE acronym, livelihoods and food security are high priorities for communities and are thus a core part of most PHE projects. We found in our report that projects incorporated a range of livelihood activities in which individuals and households produced food and/or earned additional income. For example, in Ethiopia, the Jepsido project found that almost 58% of women in their PHE project area earned additional income through alternative livelihood activities, compared with only 15% of women in communities which only received reproductive health interventions. Also, in Madagascar, 8 years of periodic octopus fisheries closures revealed positive impacts on both fishery catches and village fishery income, so much so that the economic benefits from increased landings of octopus outweighed the costs of the foregone catches due to the closures. Most projects, however, do not use a standard livelihoods approach or standardized livelihoods measurement tools, which involve careful measurement through household survey data collection of a variety of household assets, household income sources, and levels of income. And many PHE projects that are actively working on livelihoods that may be having an impact are not yet documenting changes in levels of income or diversification in the number of income sources. Since it's usually not possible or ethical to conduct research comparing integrated interventions to single sector projects in comparable communities, it is sometimes difficult to draw conclusions on the added value that integration itself brings to PHE projects. Evidence gathered for this synthesis, however, confirms earlier PHE evaluations which concluded that integration has many benefits for project implementers and the community members themselves. Many projects report that integrating community priorities such as health and livelihood activities with conservation can increase community support for interventions that may have otherwise been less popular. For example, reducing activities like slash and burn agriculture. 9 of the projects reviewed reported increases in men's support for or involvement in family planning. Several projects reported that the integrated nature of PHE encourages women to get involved in natural resources management, and they are increasingly active in PHE trainings and community meetings. While it seems to make sense that integrating activities would save projects time and money on things like transportation, social marketing, and overhead costs, we found that few projects have actually quantified these savings. Both implementers and beneficiaries of PHE projects continue to report the added value of the integration of health, environment, and livelihood activities, and there is strong qualitative evidence to support these claims. Collection of the data to provide quantitative evidence of this added value, however, is often both complicated and costly. Projects such as HOPE LVB in the Lake Victoria Basin, Tungani, and Blue Ventures are looking at alternative means of evaluation to overcome some of the barriers to measuring integration's added value, which might provide us with future guidance on the next generation of PHE projects. In conclusion, our synthesis confirms that an integrated approach can effectively address population, health, livelihoods, and natural resource challenges. But there are many additional projects working on PHE-type activities which we could not include in our synthesis due to insufficient collection, publication, and archiving of data and reports. More data on the full spectrum of PHE activities would help better communicate the full picture of the benefits of PHE and results achieved to date, and boost the case for greater investments in PHE, both individual projects and as a whole. We recommend that projects should emphasize data collection from the very beginning, including conducting thorough baseline research prior to project implementation, and develop a strong theory of change so that project focus areas and measures of success are carefully selected and defined, and partnerships are formed with organizations that are complementary and can help collect robust data for the various sectors involved. While many projects excel at recording sector-specific data, few projects have collected sufficient data to illustrate some evidence of the added benefits that we see from integrated programming in order to drive investments in something like PHE, which is typically outside of the usual funding priorities for sector-specific development. PHE projects need to pilot new approaches to document the added value of PHE projects. Implementation science and research could help the PHE community develop these techniques and make their use across projects more of a standard practice. While measuring these outcomes is rarely included in the goals and objectives of PHE projects at the start, it is often used in the justification and proposal writing process. So we recommend that projects should explore and pilot alternative evaluation approaches such as realist evaluation with partners like research and academic organizations. Finally, we need to expand the definition of what constitutes PHE to include emerging global priorities such as climate change adaptation and resilience. Projects need to use appropriate tools and metrics to measure all of the diverse aspects of PHE program outcomes. Implementation science can help with the strategic generation, translation, and use of this new evidence to improve programming in these emerging areas, such as family planning and its connections to climate change adaptation and building resilience. Here are links to the full synthesis report on PRB's website, as well as to the link on the Evidence Project site. And that's it. Thank you very much. So Clive, I think I'll pass the mic over to you to offer reflections on the synthesis report results and how they can be used for next steps in implementing and scaling up the PHE approach.
Thank you, Karen, and for the overview of the evidence project and situating the synthesis report within the project. And thank you, Kristen, for providing highlights on the report's findings. I would like to congratulate the others for the synthesis report, which I would consider very timely. I hope for those who have not had a chance to read the full report, your appetite has been whetted enough and you'll make a point to do so. Thank you, Population Council and PRB, for the opportunity to provide some reflections on the report and thoughts on next steps for PHE in light of the findings. I plan to do this in the next 5 or so minutes. I will begin by saying that the report does an excellent job summarizing the evidence on impact of PHE projects across sectors. To quote the report, this synthesis of evidence is clear that PHE projects are having an impact on people's lives, improving the health, well-being, and environment of households and communities across diverse settings and landscapes. The evidence documents that PHE has very clear and compelling family planning and other health impacts. Changes in environmental behaviors and management impacts are evident from issues such as agricultural plots to forests and fisheries. And there is evidence of efficiencies and added benefits that come with integration. End of quote. However, challenges of PHE projects to demonstrate impact still remain in varying degrees. Some are simply about the inability of projects to collect and analyze the right data at the right time. The report calls for more data on the full spectrum of PHE activities that would assist projects and the PHE community to better communicate the full picture of the benefits of PHE programs and results achieved to date, and bolster the case for greater investments in individual PHE projects and integrated approaches as a whole. To this, I add that we need more and better data, which is analyzed and communicated effectively. Despite the simple reasons, some other reasons are more complex and endear themselves to the PHE approach in particular. For instance, despite the universal recognition that people's lives are not lived in silos and hence the need for integrated programs, the burden of proof in international development is on integrated projects. So we have to really show that integration works when it's given that integration works in terms of people's lives. Multi-sector interventions are complex and the pathways to causality even more so complex. So for that reason, simple combinations of standard indicators typically used for evaluation in each relevant sector may not be sufficient. So these complex multi-layered interactions within PHE settings may require more nuanced, more sophisticated measurement and evaluation tools. Take, for instance, the impact of PHE on food security and nutrition. The pathways through which PHE contribute to food security and nutrition outcomes are diverse and complex, whether it's through investments in better agricultural practices, conservation practice that increase food stocks, especially fisheries, enhanced conservation outcomes which enhance pollination services and consequently lead to higher yields. But even more so is the challenge in measurement for some of the food security and nutrition outcomes. A number of the standard data collection techniques for food nutrition and security are anthropometric surveys, which a number of the smaller PHE projects are not able to conduct within their project spans. There are, however, many opportunities to improve monitoring and evaluation of PHE projects to develop more robust evidence of the benefits across each sector, as the report points out. We know that the demand for evidence-based human development solutions is growing. At the same time, development experts are considering whether and when integrated and multi-sector approaches work best to achieve some of the broader global development goals. Take, for example, the Sustainable Development Goals. There's been a lot of discourse throughout the SDGs on the need for integrated consider the synergies and trade-offs across SDGs thematic areas and how this is critical for the achievement of sustainable development. As the SDG agenda moves from the global to national policy and program implementation, there will be increasing attention to approaches that facilitate multi-sectoral integration across policies and programs to help deliver sustainable development. One opportunity for PHE is that implementation of PHE projects is able to contribute to multiple goals and targets. A well-designed project is able to contribute to at least 15 of the 17 SDGs. This could be a platform to inform better design, monitoring, and evaluation of the next generation of PHE projects. Closely related to this is the exploration of opportunities to guide a next generation of PHE projects to be able to use standard frameworks and metrics to better link PHE and family planning integration with other emerging priorities such as climate change, adaptation, and resilience, as the report points out. There is increasing recognition in both science and policy on the role of population, family planning, and reproductive health in efforts to increase individual, family, and community ability to adapt to the effects of climate change. However, this has not been commensurate with the programs and projects that are able to realize and demonstrate the benefits of integrated population and climate change benefits. PHE projects provide a good example of how integration of population and family planning across climate-sensitive sectors such as health, environment, energy, food security, water, sanitation and hygiene, and livelihoods. But PHE projects hardly documenting the climate change benefits that accrue from the implementation of multiple integrated development activities. In short, and as a summary, this review is a great wake-up call for the PHE community to better design, measure, evaluate, and communicate their project's ability to contribute to multiple development benefits through targeted interventions in various sectors. Thank you very much, and I look forward to your questions.
Great. Thank you, Clive and Kristen. Thank you so much for the presentation and your reflections, Clive. And I, of course, particularly appreciate you linking the PHE work with climate change and climate change adaptation. We have some questions. I would like to start, though, with something that came from Vic Mohan from Blue Ventures. Vic said, we're grateful to the authors and we're so sorry we weren't able to participate in the webinar, and we're particularly excited by the call to pilot new approaches to document the added value of PHE projects. And he says, we maintain that we need to think differently about evaluation if we want to capture the full richness and impact of interventions as complex as these. And what's next isn't really a question, I don't think. It's more of a call for all of us. He says we remain fascinated by the question of how it is that our PHE program is working. And by hoping that by answering this question, we can capture some of the added value. So he calls on all of us to document the stories of people whose lives have been touched by the programs that we run. He said this would enable us to share and examine these stories, look for themes, and tease out possible underlying processes. Ultimately, then we can test these ideas to see if they represent the mechanisms by which some of the added value of PHE is generated. So again, that from Vic Mohan from Blue Ventures. So now I'd like to, the first question, Kristen, I think I'm going to turn this over to you, and it says, thanks for this impressive project. My question, what were the main criteria that you used to choose those countries that were included? So Kristen, maybe you could just mention how the countries were included in the synthesis.
Sure. Can you hear me, Karen? Okay. Yeah, so the 35 projects that were included in the report didn't necessarily define themselves explicitly as PHE projects, but when we reviewed all of the project documents, we found that each of the projects integrates aspects of population health and environment in some way. And essentially, we didn't choose them by looking at certain countries and saying, okay, we're going to choose this country's project and not the others. Instead, we just identified as many projects as we could by looking through sources such as the K for Health PHE Toolkit, a PHE project Google map that Population Reference Bureau put together a couple of years ago, submissions and proceedings from the 2013 International PHE Conference that was held in November 2013 in Ethiopia, and also communications with PHE professionals. So we felt like we did a pretty thorough sweep to find as many PHE projects as we could. It took, I guess it was about a year-long process to do that, so we felt like it was pretty thorough.
Thanks, and you really reinforced the need not only to look at sort of in the published literature, but also look at reports and talk to people about ongoing projects. Thanks. Clive,
Yes.
a question for you. This is, in light of the research from the latest generation of PHE projects that's been synthesized in this report, and the gaps in the evidence base that have been identified, do you think we need more research specifically focused on the value-added benefits of PHE? And what role do you think taking a realist evaluation approach could play in contributing to our understanding of PHE?
Thank you, Karen. My answer is yes, we need more and better research on the value-added benefits of PHE, because that is one of the challenges that the PHE community has been grappling with for some time now. And the moment that we successfully document and show the value added for the projects, I think the easier it will be to make a case for scaling up of PHE approaches from small community-based activities to probably bigger sub-national national programs. And going to the question about the role of realist evaluation, I would say that, of course, to address this growing demand for evidence-based development solutions, evaluation methodologies will continue to evolve. Of course, the emphasis is moving from standard processes and outcome evaluations toward the use of more rigorous impact evaluation. And I have a chance to hear some information about realist evaluation, and I think realist evaluation is one of the evaluation methodologies that can be applied and tested to show how PHE works and the contribution of PHE to the value added benefit. So yeah, I think realist evaluation, as well as other evaluation methodologies have a big role to really help the community or practice to understand the ways in which PHE works and makes impacts on people's lives and livelihoods.
Great. Thank you so much, Clive. The next question I think is directed at me, and it's, are there opportunities for the evidence project to follow up on this synthesis? And what will your project be doing next related to PHE projects and evidence? Absolutely, we want to follow up on this. In fact, this was the synthesis of this PHE evidence was one of the first synthesis projects that we started when the evidence project started in 2013, because we realized at the time that there were still a lot of sort of questions out about, well, you know, what's the benefit of PHE, and, you know, should we just be supporting family planning services on their own rather than taking this integrated approach. So we're delighted to have this this synthesis of evidence, and we are taking the next step to, as Clive just said, to sort of delve more deeply into specific projects and seeing what this value added is, and also trying to branch out to look at lessons learned from PHE and what we can take or maybe integrate into PHE projects to better link those with climate change, building resilience and climate change adaptation. That's certainly our next step. And maybe I can turn it back to Clive, because a lot of us remember when USAID actually funded entire projects on PHE, and now there's no sort of single project within USAID on PHE, but it seems, Clive, like you're trying to integrate sort of PHE approaches into other existing projects. So maybe you can speak a little bit about what's next for AID and that's been a strong funder of this work over the years.
Yes, I wanted just to mention that for those who have been in the PHE community are aware that USAID has been a strong supporter for PHE programs dating several decades ago, and the work continues to evolve, and trying to see what USAID's critical role remains in the field. Of course, trying to look at the three areas that the work has been supported traditionally, which is the global advocacy, but also kind of supporting field-based programs on the ground, and also some of the work around knowledge management and research evidence. And this, the webinar today and the report is part of the synthesis. Of course, all of us are looking forward to how USAID continues to engage in this space, and it's something that continues to evolve over time. I would not be able to specifically say how the work looks like outside a dedicated PHE activity, but the efforts that are being pursued also involve trying to get support for integration of the work across other development sectors, and that is also coming very clearly from this report. It's more of trying to show the value add even in other sectors which PHE has not traditionally reached. For example, working with colleagues in the Bureau for Food Security who are looking at work around Feed the Future. So trying to show our PHE approach can be an approach that can be good for some of the food security and nutrition outcomes around broader goals like sustainable development goals, whether it's the process moves to national level. How do you create the enabling environment to make sure that more support comes even from country programs themselves, and how do they look at PHE? Is it an approach that can work at both national and subnational levels, and trying to also get political commitment from countries themselves?
Excellent. Thank you. Thanks so much. The next question is for Kristen, and that is, we know it's difficult to get data in remote areas. How can PHE projects reach these remote areas? Kristen, what did you find in the programs that you looked at for the synthesis?
Sure, thanks, Karen. Yeah, we essentially found that PHE projects that are located in the most remote areas, so people with in communities where people have the least access to primary health care and reproductive health care, it's in those areas that PHE projects are often able to achieve better results. And I think, you know, it's a challenge to collect data in remote areas, but that's where there's the greatest need for integrated projects like PHE. And so I would just say that, you know, projects need to build in enough funding to collect the data and to do the baseline surveys and do the midterm evaluations and final evaluations to be sure that they're able to collect the data. And I think you know, donors and funders need to understand that that is an important part of PHE projects, since, you know, our synthesis basically shows that we need to do a better job of collecting data on all types of indicators. Funding for that needs to be built into the projects from the start.
Mm-hmm. Okay, thanks. And this is a follow-up question, and I'll open it up. Whoever of you wants to jump in. Somebody says thanks for the presentations; they were nice. But says, I'm wondering, however, how we can call for standardized standardized indicators a theory of change, etc., while at the same time acknowledge the point that Clive makes about the complexity and situated nature of PHE. Are we, both implementing organizations and donors, guilty of paying lip service to the complexity of PHE, but insisting on highly simplistic causal demonstration and evidence? So, Kristen, maybe you want to start, and Clive can also chime in? Are we setting PHE projects up for failure when we acknowledge the complexity of them, but ask for sort of standardized indicators and simplistic causal models?
No, I don't think so. I think we're just asking people to think through from the start. You know, when we say theory of change, it's really thinking through from the start, okay, these are our end goals for our project. And if these are our goals, you know, what are the various steps we need to take during implementation to achieve those goals for the communities? And then thinking through really carefully, okay, what are the indicators that we need to select to measure our achievement toward and our progress towards reaching those goals? It doesn't mean that you necessarily need more indicators. It just means that you need to select them carefully so that you're not necessarily measuring more things. You're just really carefully choosing what you're going to measure so that you can see at the end whether you've reached your goals that you said you wanted to reach. And then I think we're also saying, so that's sort of for the sector-specific indicators. Then I think what we also are saying, based on the results from the synthesis, is that we need to figure out a way to better measure the added value that PHE offers. And that's what Clive talked about in his discussion. And you know, that's a challenge for PHE projects. And like Blue Ventures had said, is realist evaluation a way to do that? You know, how can we capture both the quantitative and the qualitative aspects of the added value that PHE projects bring, you know, for the communities themselves?
Mm-hmm.
So Clive, what do you think?
Sure. I mean, I could maybe add something briefly on that. I think when we are talking about the complexity of PHE, it's kind of at the academic level, because when you go to a PHE project in the community members don't find it so complex, because that's the life they live every day, and everything makes sense to them. But I think for us as development practitioners, and given the reality in that sphere, then we kind of need to really articulate a very strong theory of change. And the theory of change some of the time is, what set of interventions are you planning to implement? For instance, Kristen mentioned that a number of the interventions are at the household level. So it's an issue of trying to understand the various interventions, the household level, how do they contribute to outcomes, some of which are at the community level? How does, for instance, an activity such as a village woodlot or a family woodlot contribute to afforestation or tree cover outcomes, which might be one of the outcomes in environmental conservation? So I think because there's so many development outcomes that we are trying to address, at the same time being able to attribute the causality and the specific pathways is a big challenge in terms of the measurement, given that some of them are also very small communities in remote areas, and being able to really collect all the data that is needed is a big challenge. But of course, I think within the theory of change, it's not that the standard indicators are not useful. It's about making it clear what the interventions are, what the pathways are, and what are the outcomes, both at the community, at the individual level, and at the broader scale.
Mm-hmm. Thanks. And I just want to highlight, Kristen, I know you said it, but something that from the report that really sort of stood out to me, and that was that said that it's really not sort of fair to hold PHE projects up to a higher standard of contraceptive prevalence than sort of just single family planning programming. That you know, if PHE programs get, you know, as good family planning prevalence as existing programs, that should be sufficient. So we don't really need to discuss it, but that was something that I just wanted to sort of highlight that I took away from the synthesis. So
right, exactly, especially when they're operating in more remote areas. If they can get the same
exactly.
increase, that's pretty good. So
yeah. So another thanks for a great webinar. We at the Phantom Project recently completed an extensive desk review looking at integration of family planning and food security and nutrition projects, and PHE was an integral funding stream that they looked at looking at the projects. I want to reinforce what Vic said. There's a real need to improve not only the evidence base, but also basic documentation through case studies and stories and lessons learned of PHE projects. Our selection criteria were based on a set of outcome measures by the projects. Two big limitations we found in the PHE evidence base is lack of documentation, reports easily available, and, as the evidence project report confirmed, lack of consistent measurement across the project. So I think, yeah, it's interesting because we're sort of talking about, we're not looking at just one theory of change for all PHE projects, but or necessarily standard indicators, but to the extent that there can be sort of a meta theory of change and at least some standard indicators, it actually would help for you know, for our understanding of the projects. So I don't know if Kristen or Clive, you want to comment on what the person from Fanta said.
No, I mean, I totally agree with the comment, and yeah, I've been able to look at the funder report and seen how the analysis kind of identified some of the PHE projects, and the same challenges that we talk about also coming out very clearly. That is the evidence lack of documentation, and that's one of the components that I mentioned that PHE attempts to do by trying to see how best to bring out the information. I mean, it was one of the challenges that I also mentioned. Some of it could be as simple as projects not being able to collect being able to collect and analyze the data, but there's also we have a PHE framework which identifies some standard PHE indicators, but if you look across, there's also a PHE guide by measure evaluation. But if you look at the projects that have been implemented, whether they are using the standard guides and guidelines and processes, I don't think the answer would be yes. So that's a big challenge in terms of consistency to measure across projects. And I mean, it will be at some point great if the project implementers would maybe share with the community why some of the resources that are out there, why is it so, where the challenge really lies in terms of being able to consistently measure and report across projects.
Mm-hmm. So, and we have one last question, and this is, my question is regarding calling this whole area of work PHE. You described it as humans, their health, and the environment. And there isn't data on population pressure, but rather on fertility and CPR. What opportunity is there to expand the name of these projects to be more than just PHE? And Clive, since you've recently had a title change at AID, I think I'll turn this question over to you.
Thanks, and probably Kristen would also talk about it, because I remember in one of the slides in the report that there's a very clear finding that despite the P, and I think that was one of the first slides, despite the P, most projects are not able to measure the population pressure, but they are only reporting on fertility and CPR. So that has been identified as a gap in the report. And to me, it's not an issue of naming the PHE, because some of the projects are, most of the projects are not more than 5 years, and they are not reporting on, let's say, total fertility rate. And it also goes back to the issue of the theory of change. Do the projects aim to reduce the TFR within the 5 years? So to me, yes, there could be an opportunity to expand the name of these projects, but the most important take is that PHE is an approach that tries to to integrate a number of sectors, population, health, and environment. And in some projects, some of the projects that are doing this might not be identified as PHE projects, and that's also something that Kristen mentioned at the beginning. So of course, that's a gap that has been identified in the report, and would welcome to have that discussion.
Yeah. Kristen, do you want to add anything?
Yes, I would agree. There's lots of opportunity for PHE to expand beyond, population health and environment. Like the report found, livelihoods are a critical component of a lot of PHE projects. Some projects are already incorporating climate change adaptation into the work. When I was in Madagascar even 10 years ago, all of the projects working on PHE there took up the USAID framework of nature, wealth, and power, but called it nature, health, wealth, and power. So that's a USAID framework that came out of the natural resources sector years ago. And, just thinking about different ways to integrate different sectors, whether or not it's called PHE, nature, health, wealth, and power, whatever the acronym is, I think the sentiment is the same, is that at the community level, what makes a difference for people and what they want is, development projects that are sustainable and meet the different integrated aspects of their lives. And so whether you call it PHE or something else, I think as long as you're working at the community level in an integrated way, you're helping achieve those results. So.
Great, thank you. No, I think that's sort of a long-term question of the population term, and whether that adequately describes the sort of breadth of all that we're doing, and I think we agree that maybe it doesn't. So if anybody has brilliant ideas for a new naming convention, we'll all be part of that discussion. So thank you for joining this webinar, all of you who stayed on for a few extra minutes to make up for the bit of the technical difficulty that we had at the beginning. I just want to really thank our two presenters, Kristen Patterson and Clive Mutunga, and for PRB for sort of being the host for the webinar, and for all of you for joining. Thank you so much.